Drug addiction and opioid abuse have claimed millions of lives, triggering President Trump's public health emergency declaration last week. The president has mobilized his administration to address the issues.
Now we're hearing about an Austin surgeon who's taking on the opioid crisis by drastically cutting back on the amount of painkillers he prescribes. In fact, he doesn't give any to 85% of his patients. KVUE's Jenny Lee has his story.
This incision is 1.5 years old, and this one is 2 weeks.
Dr. Tyler Goldberg reconstructed both of Bunny Christie's knees.
That's great. And then we'll just check the stability here.
The difference between the two surgeries, he didn't give her painkillers the second time around.
If I can kind of intervene prior to them ever getting addicted or using those narcotics to control their pain, then maybe I can stop a little bit of this post-operative addiction tendency.
Dr. Goldberg says pain protocol involves conversations with patients, making sure they understand the recovery process will be narcotics free, which was just fine for Christy.
Because I was so, the first time.
Besides loopy, it took Christy a bit before she was able to get back into her life.
It was over 2 weeks before I got back into the swing of things.
Instead, Dr. Goldberg prescribes Tylenol, ice, anti-inflammatories, and lots of movement. He says 15% of his patients still ask for painkillers, which he gives. The orthopedic surgeon is just extra careful when doing so.
People can become addicted or develop physical dependence on opioids in less than 7 days. And if I'm prescribing patients for pain medicine for weeks and weeks on end, there's potential that I could be addicting patients.
The surgeon of 14 years says since medical school, he's learned that pain is a fifth vital sign, comforting patients and dealing with their pain right away. Dr. Goldberg says he still wants to do that, only in a much safer and non-addictive way. Jenny Lee, KVUE News.
Well, it is certainly a big problem. Maybe that's one little way to help combat it.